Good afternoon, everyone, and welcome to today's Outreach Connection webinar for licensed childcare centers. My name is Emma Kurth, and I am one of the licensed childcare center training specialists for the unit. And first, I want to start out today by saying thank you for being here with us today, taking your afternoon to do this. And also, we want to thank you for everything that you're doing for children and families throughout Minnesota. Outreach Connection webinars like this one are one way that we as a licensing team have worked to bring together relevant information from us and from some of our agency partners to make sure that you're hearing information straight from us, in addition to email and what we put out on our website. We work hard to try to connect with you and hear from you in a variety of different ways and partner to support the work that you're doing with children and families. And today's presentation is just that. It is a way for us to connect with you and provide what we hope will be helpful and useful information. As you can see, we have a full agenda for this afternoon with time allotted at the end to allow for questions that you may have. Before we get started, we just have a couple housekeeping items to go over. First, an accessible handout with links to more information from today's Outreach Connection webinar will be posted to the DCYF Licensed Childcare Center website under our webinar and outreach section in the coming days after today's presentation. That's going to be the same handout that you saw the link for on that first slide, and I'm also going to add the link to that handout to the chat in just a few minutes. And it'll be visible again on the very last slide. I also want to note that today's webinar is being recorded, and once that is transcribed and captioned, we will get it up online on our website within the coming weeks. So as we go through the presentation today, please put any questions that are coming up for you into the chat box. And you'll look for the option at the top of the chat box that says direct. It'll appear next to everyone. It'll say direct. And then you'll select chat with all panelists, which will appear below. It's kind of a green and blue icon in the chat box around mid-page. We are going to kick off our presentation now with our licensing division director, Mary Kelsey, and she will speak to you about licensing updates and the division's move to DCYF.
Thank you, Emma. Hello, everyone. Good afternoon. Emma, can you hear me okay? Okay, just making sure. Sometimes I have technology challenges. Good afternoon, everyone. Welcome to this session today. I serve as the licensing division director for our licensing division in the Office of Inspector General here at DCYF. And so I'll just start out with, some conversation about our new agency. So as many of you know, the Department of Children, Youth, and Families, otherwise known as DCYF, is a new state agency that initially launched in July of 2024. And then the licensing division, along with our Office of Inspector General, moved to DCYF a year ago in June of 2025. So we've just celebrated our first birthday here at the new department. The creation of this new department was a bold plan to realign state government to better coordinate all the resources and the systems that serve children, youth, and families, investing in the vision and mission that Minnesota is a state where all children can and do thrive. Over the course of 2 years, there were various programs from the Departments of Human Services, Education, Health, and Public Safety, which you can see here on this slide. And then underneath those departments, it shows the teams and administrations that transferred to DCYF beginning back in mid-2024. So next I'll talk a little bit about the agency goals. So the goals of DCYF, first of all, are to align outcomes and pursue equity for children, youth, and families across our state government. And then second is a second goal was to elevate policy priorities and funding needs of children, youth, and families in budgeting and decision making. And then a third goal is to focus local partners on improving front door services with a goal to ease access and navigation. So what this means is that at DCYF, there's no wrong door, and you won't get turned away if you contact the wrong team first. And then finally, The goal to sharpen the focus of all impacted state agencies to best address the issues central to the people that they serve, which is, of course, the children, youth, and families. So, what does this all mean for childcare licensing? So, our childcare center licensing and certification teams did transfer in whole to DCYF, and for the most part, things have not changed in the licensing process for licensed and certified programs. What has changed is that your license certificate will now show that it's issued by the Department of Children, Youth, and Families. And then we've also been working to update all of our forms and resources, including rebranding everything with the DCYF logos and headers. And of course, modernization is on the horizon for July 1st of next year, which you'll hear a lot more about later this afternoon. In the meantime, all of the current rules and statutes remain in effect until the new statute is implemented next summer. So now shifting over to talk a little bit more specifically about the Office of Inspector General at DCYF. Our structure here is similar to what it was over at DHS. Randy Keys serves as the Inspector General here at DCYF. Under Randy's leadership here at DCYF are 5 divisions. First, that you can see there on the chart is our legal counsel office. It's the purple chart in the middle there. And that's the area where reconsiderations of correction orders, conditional licenses, background study disqualifications, all of that work is done in our legal counsel's office. And then next, of course, is our licensing division, which I'll share more about in a minute. And then we have next to that is the operations, policy, and analytics team, and that includes our policy team, who some of the members of whom you'll hear from today, and then our data analytics team. And then next there is the Program Integrity Oversight Division, and their title speaks for itself. And then finally, the Chief Compliance and Ethics Office. This is an additional office that has joined the Office of Inspector General since our transition over to the new department. So, of course, the licensing division is where you find child care centers, along with intake and investigations, child foster care, and family child care. And then just to talk more specifically about our child care center licensing unit. So our unit, the licensing division, of course, plays a critical role in monitoring and supporting health and safety in licensed and certified programs across the state. As of May, there were approximately 1,800 child care centers and 600 certified centers across the state. And our unit for this work is comprised of a manager, an assistant manager, 6 licensing supervisors who oversee 38 licensors. Some of the licensors specialize in early and often programs, so that's where during the first year we make additional visits to programs to support their early learning and compliance. And then we also have licensors who, after that first year, oversee licensed childcare centers. And then we also have licensors who specifically oversee certified license exempt childcare centers. And then last but not least, our team also has 3 administrative support and then 2 training specialists. Our child care center unit has certainly seen some changes over the past year. In addition to joining DCYF, as some of you may know, Peggy Cunningham retired in January after 30 years working with this team. And although we were sad to see her go, we are glad to know that she's off enjoying her latest adventures. Kimberly Summers, the assistant manager of the unit, is currently working out of class in that manager role, and we do anticipate filling the position permanently by the end of summer. And then there's a few other longtime people that have left that we thought we would mention today. One is licensor Kelly St. John, who was here about as long as Peggy Cunningham, so a longtime staff here who retired. Training specialist Rena Henjum retired over the winter. And then most recently, our supervisor Chad Kraske retired after 20 years of service. Um, so we've seen some changes. Many of you may have seen new licensors coming to your program. to help a coworker out. We're doing some inspections where licensors are partnering with each other, or maybe you've gotten a new licensor. We just want to reassure you that this is all a natural and normal part of our child care unit growing and evolving over time. No matter who from DCYF comes to your program, please know that we are all here for the same reason. The children and families who rely on you every day to provide care and learning for their children. So I'll just wrap up by saying thank you for being here with us today and for all the good work you do every day caring for and supporting Minnesota's children and their families. And I will now turn it over to Nadine for her child care Wayfinder updates.
Thanks, Mary. And I want to thank licensing just for inviting me to talk about the Child Care Wayfinder program. I do work at DCYF and I work under the Child Care Services Division in the provider workforce and supports unit. And basically the section I'm in is really around building capacity for child care. So today I'm just giving you a brief overview of Child Care Wayfinder. And Emma, you can move the slide forward. So Child Care Wayfinder is our state's one-stop assistance network to grow, strengthen, and expand and start our child care programs. It was created through legislation in 2021 and implemented and launched in 2022 by Child Care Aware of Minnesota. The overall purpose of this program has been to increase access to licensed child care across Minnesota by supporting applicants, providers, and child care centers through the licensing process. We work with both individuals and exploring child care for the first time, and with child care centers and family child care programs that have been licensed for many years. The goal is to make sure everybody has support, clarity, and access to resources at every stage. Child Care Wayfinder is staffed by local navigators at regional child care aware of Minnesota agencies and the Minnesota Tribal Resources for Early Childhood Care, which is MNTRAC. The map on this slide shows the child care aware service area, which includes 5 districts and 11 regions with more than 35 navigators. Because navigators live and work in their local communities, they understand local child care needs, know the available resources both locally and statewide, and they build strong partnerships that support centers more effectively. The plan is for navigators to stay connected with people throughout the entire licensing journey and also ongoing and being available ongoing whenever that may be. It could be 2 days later after they're done working with somebody. It could be a year, it could be 10 years later, that they're always available at any point of that journey, even once you're licensed. Supporting childcare providers, we believe, is essential for increasing childcare capacity in Minnesota. The work that navigators do is organized into 4 main areas. The first one is outreach and recruitment. So navigators proactively are reaching out to individuals and programs who may benefit from support, whether someone is just exploring the idea of opening a center or an existing center wants to strengthen or grow. Outreach efforts focus especially on communities with the least access to care, with the highest barriers to becoming licensed. Another core role is technical assistance. Navigators offer direct technical assistance. So it's from planning and understanding licensing steps to business readiness and expansion support. They help participants understand requirements, stay organized, and access available resources so the process feels more manageable. A third role that they play is resource and referral. Navigators connect participants with trusted resource partners, including training for providers, financing opportunities, business coaches, grants, and licensing supports. And that is just a beginning of, it's not a limit of those things. Navigators don't do everything themselves, but they act as the hub, making sure people are connected to the right support at the right time. And then finally, which seems kind of an odd role, but it really is extremely important to the work that we do, documenting successes and challenges. Navigators track what's working well and where programs face challenges. Success stories help us identify models that can be replicated statewide, and documenting barriers helps us understand what slows or prevents progress. This information guides system improvements and strengthens services across Minnesota. And then lastly, partnership. While Wayfinder success depends on strong partnerships with other capacity building programs, organizations, licensing, family and childcare centers, and the community. While navigators focus on building relationships and connecting participants to resources within their community, DCYF and many other partners are working together to improve coordination and support for childcare programs statewide. We know that there's more work ahead to address systemic barriers, capacity gaps, and workforce challenges, but there are also real opportunities for deeper partnerships, shared problem solving, and more coordinated strategies. As we continue to learn what licensed centers need, we hope to strive to grow our partnership with you to support this ongoing work. If you would like to connect with the Wayfinder Navigator in your area, that link or the website for Wayfinder is in the handout that Emma did include in the chat. It also includes my email if you want to connect with me directly about anything related to the support that you need as a childcare center. We do, and we want to hear from you because we really believe that the better we collaborate, the stronger we become to strengthen Minnesota's childcare system. And I'm always available at any time, even after this presentation, to have you guys contact me if you have questions or concerns. And I will pass it on to Brandon and Kent, I believe, which is the main portion, I believe, of what we're going to be talking about.
Thank you. Thanks for the warm handoff. I'm Brandon Tice. I'm a licensing policy analyst here at DCYF Office of Inspector General, and I am going to give some updates on the implementation plan for 2025 legislative changes. So these were changes that were passed not in the session that just ended, but in the legislative session from 1 year prior. And we originally shared that implementation plan for childcare centers, and then we had some updates to it that were recently sent out. And I just want to go over what those updates are for you, just kind of highlight some things. So we'll do that, and then we'll get into the childcare regulation modernization project and the big change, which is that the licensing standards are passed, the revised licensing standards. So we'll talk a little bit more about that. Okay, next slide. Okay, so we sent out an updated implementation plan for 2025 legislative changes that had a July 1st, 2026 effective date. So all the ones that I'm going to go over are effective now. So we're going to cover standardized licensing visits, interpretive guidance, and video security cameras. And just to note that we will share an implementation plan later this year for 2026 legislative changes. There are the childcare licensing standards, so there will be kind of an ongoing, more continuous resources information provided about that. But in addition to that, the big change for 2026 is the abusive head trauma training must now be interactive. So you have to fulfill that training requirement with an interactive training, so there will be more information coming out about that. We're aiming for the fall, but later this year. Okay, next slide. Okay, so let's talk about standardized licensing visits. This passed in 2025, the requirement that DCYF create this resource. The handout, which Emma has linked to, so you can go directly and take a look at this. It goes over the steps of a licensing visit, the expectations both for you as a license holder and for your licensor to follow, standards of conduct, the rights you have as a license holder, and then it also goes over technical assistance. So how to reach your licensor, whether that be the licensor, your specific licensor, or the licensor on call, and whether that be over phone or email. So basically, if you need help coming into compliance with something, or you just need help with how do I do this specific thing, what are your ideas? That all of the ways you can request that from your licensor. And then also goes over reconsideration requests and appeals. So reconsideration being the existing process for how you can request that you want a correction order to be reconsidered, but it also goes over all the other requests you can submit to the department when you have a licensing action. Okay, next slide. The other thing we wanted to cover is interpretive guidance. So this is, in addition now to reconsideration, a right that you have as a license holder. So an applicant, license holder, or authorized designee, you may request interpretive guidance if you believe a statute or rule is ambiguous or has been interpreted incorrectly. So this has to be related to a correction order you receive. So now that it's past July 1st, if you were to receive a correction order on a recent visit now, you could say, I think this language is ambiguous, or I don't think they interpreted this quite right. I am going to go to this online form, which is available on the Child Care Center licensing webpage. It's also linked in the handout that Emma shared. Fill out this web form, and I am going to request that the department give me interpretive guidance on how they interpret this part of the statute or rule that I was cited on. So a couple things to have ready when you do that is you should know which specific citations you want to request interpretive guidance on, and again it has to match up with what you were cited for a correction order on, what you were cited on. You also need to submit that within 20 calendar days of receiving the correction order. So just want to make sure that's clear as well. Next slide. So upon receiving that correction order, and this slide is about sort of the interplay and the relationship between interpretive guidance or reconsideration. And this is due to just how this statute is written, when this legislation passed. Basically, you need to, so if you request reconsideration first, interpretive guidance is no longer available. The way it's written is that, you can request interpretive guidance prior to requesting reconsideration. So you can first start by requesting interpretive guidance if you think it's ambiguous. And then after you get that interpretive guidance, so after you get the department's response, you could also request reconsideration. And you have 20 days after you receive our interpretive guidance response before you can, within that 20 days, you must request the reconsideration. So you could do interpretive guidance request, receive that, then request reconsideration, or you could just, if you just want it to be reconsidered, you could just go straight to reconsideration. If you want to dispute the correction order. And also interpretive guidance responses are final and they're not subject to further review or appeal. Next slide. Okay, the final piece on the implementation plan I want to talk about is video security cameras. So beginning July 1st, any program that has received an order of conditional license, a license suspension, a temporary immediate suspension, a fine, or a revocation accompanied by a maltreatment investigation memorandum must have at least one video security camera in each room designated for infants or toddlers. Just want to point out the most important piece of this is that it only applies under these limited circumstances. So this is not a universal requirement. So if you get that maltreatment memorandum, if you if you're having to post that maltreatment memorandum, you need to be in compliance. And the other really important thing is the department will notify you if this applies to you. So if you're sitting and reading this language and wondering if it applies or not, unless the department has notified you that this requirement applies to you, then it does not apply to you. And we are also encouraging you to work with your licensors on implementation. So we are working with our licensors because we understand that this is a more technical item. It's not the kind of thing that we're as used to in the early childhood field. So we're helping our licensors out so that they can be a resource. So please, if you have questions on this, if this does apply to you, reach out to your licensor. But again, I think the most important thing is that it's only under these limited circumstances. This is not a universal requirement, and you will be notified if you have to comply with this video security camera requirement. Okay, next slide. All right. So I am gonna now switch gears. We're gonna talk about childcare regulation modernization. I'm just gonna tee it up and give some context on how we got to where we are. And then Kent is gonna share some of the most significant changes in the new standards. And then after that, we'll have time for questions, either for our policy team or for any of the people that you heard from today. Okay, so next slide. Okay, this is our regulation modernization team. Catherine focuses on family childcare. I focus more on the childcare center side, and then Kent gets to have fun doing both sides of the project and learning both sides. So that's us. Next slide. So this is our project at a glance. You probably have seen this before if you've heard from our team. Just want to point out that we're talking about the revised licensing standards today, but there are two other components of the project, and just want to give an update on how these components are going to be rolling out with the new standards. So as Mary mentioned, the revised licensing standards are not effective until July 1st, 2027. The plan is that the risk-based tiered violation system, so having, we always refer to this as the weighted risk system, where you have a weight assigned to each regulation based on the level of risk. So that leaves you with some lower risk items, some medium risk items, and then some items that are identified as high risk regulations. It will be rolled out alongside the new licensing standards on July 1st, 2027. So the new standards will have those weights assigned right at that initial implementation. The other component you'll see on here is the key indicator system for abbreviated inspections. And abbreviated inspections will need an extra year at least after implementation. And the 1 year really is just, it is the key word there is key indicator. The key indicator is a statistical analysis that identifies for all of the licensing inspection data, what does the data show are that small subset of regulations that statistically predict compliance. So if a provider was to violate one of these key indicators, statistically the data would show there may be some more some more compliance concerns there. And having that key indicator set is what allows us to have that shortened inspection. So all of that's to say that we need the licensing inspection data for at least a year to be able to do that process and to have that be a good sound methodology. So all that's to say that basically July 1st, 2027, you'll get the revised licensing standards and the weighted risk system, and we have a lot more to share about how we're going to prepare you for that. And there'll be lots more communication. But then abbreviated inspections are going to be, another year out from that, just so we have time to get that licensing inspection data under the new standards. And again, I know this may be a lot, but we're going to communicate as we go, but just wanted to share a little about the timeline. Next slide. Okay, so this is just a helpful reminder of how this project started, why DCYF was, initially the Department of Human Services, and then moving to DCYF was tasked with revising the licensing standards. In 2021, the Minnesota legislature directed DHS to work with NARA, work with NARA originally to develop revised licensing standards. And the two pieces here is that they are grounded in national regulatory best practice and must protect the health and safety of children and be child-centered, family-friendly, and fair to providers. So that is the initial task behind this project. Now the revised licensing standards have passed. It's our job to continue to keep this focus and really to make sure that things are fair to you, that they're family friendly and child centered as we're getting ready to implement these standards. Next slide. Okay, so the 2026 session is when the legislative session that just ended, the licensing standards were passed. You can see here, and it's also available in the handout, that there was a Senate Health and Human Services omnibus bill. That's those big bills that have a lot of stuff in them. The childcare licensing standards were included in that. So if you go to that link and you go and you can search within it and find Article 12 for the Child Care Center licensing standards. So all of what will be the new Child Care Center licensing standards is included under there. So you can go through and read those. And then later this fall, the Office of the Reviser will actually publish more of the actual statutes themselves, even though, again, they're not effective until July 1st, 2027. And I think the point I want to emphasize here is that 2021 is when this project was first authorized, and then 2026 session is when the revised licensing standards passed. So all throughout that time, really starting in March of 2022, there was ongoing stakeholder engagement and multiple drafts and iterations to shape the licensing standards that were proposed. And then after DCYF proposed those licensing standards, then the legislature took it and amended it and passed what is now going to be implemented by the department. So just to say, it's been a multi-year process. There's been a lot that's gone into the standards that you'll read in Article 12, including a lot of your voices, licensors, the public. So there's been a lot going into it, and so now when implementation, we're making sure that everyone is clear about the expectations going forward. Okay, next slide. So this is just a little bit about what we're doing going forward. Right now, we're planning for implementation. We're getting all of the pieces set and making sure we have the work groups and the work streams spun up so that everyone knows what needs to be done, and doing all those pieces and making sure we can do it on time. There, as I shared, we will share more information in the implementation plans, which will be out later this year, at a higher level, and then there will also be a lot of additional materials created. We need to update all of the forms. We need to get the weighted risk system updated with those, the weights for the new standards. We need to develop the trainings for licensors and for you as providers. And then we will plan to have those materials and do that training before July 1st, 2027, well before that time, so that you all can feel comfortable with what you need to do to be in compliance. Next slide. And I think now I'm going to let Kent go over some of the specific changes in the new licensing standards. And yeah, feel free to put any questions you have as we go in the chat, and we can address them after. Kent?
Thanks, Brandon. And I'm going to ask Brandon to hang around because we kind of tag team on some of this. And you've been listening for 30 minutes. Take a breath, relax. Thank you for making it through the first 30 minutes. As Brandon mentioned, and something I want to reiterate now, and I'll probably say it a few more times, nothing that we're talking about from here out in terms of what has changed will be enforced or law before July 1st of 2027. So nothing I'm about to share with you is you have to do it tomorrow, next month. We have till July 1st of 2027 before any of this becomes law. So first up is director qualifications. As you can see, we've increased some of the qualifications here for directors. The idea was directors have more responsibility. Therefore, we're going to ask them to have a few more requirements. And without reading this all to you, you can see we moved from 18 years to 21 years old for minimum age. Directors may serve as teachers in a substitute capacity. And then this is important, the grandfather/grandmother clause. If you are currently a director or you're a director as of July 1st, 2027, you don't need to meet the new director standards unless you move to a new center. So you will be, you'll keep your director title and your title, but then if you move, you'll need to get those extra credits or hours of training. Um, yeah, so I guess I'll leave it at that. Next slide. And I should mention too, a lot of this, like, as Brandon mentioned, like the bill and our newsletters are on our website. Easiest way to get there is just Google Minnesota Child Care Modernization, and you'll get right there. I just had a note there to remind myself to let you guys know how to get there. Teacher qualifications, there's a lot here. I think the gist here is, in listening when Brandon and Catherine and DCYF was going around the state listening to providers and parents, as Brandon said, in these 4 years of building this project up, one thing we heard consistently was, we need some flexibility to get people in the door to help us, to work for us. And so the changes you see on screen right now have come down, but they pretty much match the variances that we had been seeing and matching the market that we've seen and heard is happening in Minnesota right now. So the idea is, for teachers, and you'll see aides and assistant teachers, we dropped some of the requirements to help centers, particularly, get folks. You can hire folks, you can get folks in the door, get them on the ladder, and keep your businesses open. So you can see on the left, that's the current rule, and on the right, that would be the new standards that people would need to meet to become a full-fledged teacher. Next slide. Same story here for assistant teachers. Here's the requirements. Brandon, I don't have a note. I should have written a note on here. I believe that these came down a bit too. Confirm that.
Yeah, that's right. And as you can see, it's simplified quite a bit from the existing rule. So in the existing rule, the teacher and assistant teacher kind of mirrored each other with that chart format of, if you have this credential, you do, then you need this amount of experience or education. So with these assistant teacher qualifications, it's just simply, if you have 6 post-secondary semester credits, or if you have 50 hours of the commissioner approved training within the last 5 years, or 160 hours of experience, and you're also making progress towards one of the teacher qualification options, then you are assistant teacher qualified. So it's quite a bit more flexible. The goal was just to allow easier sort of entry into that assistant teacher role, and then to get people into the teacher role, kind of again based on some of the staffing concerns we were hearing.
Perfect. Thank you, Brandon. Next slide, please. Here you can see some changes on the aides and substitutes. The one thing I want to highlight here, the times we've been talking to folks doing this slideshow, the one thing everybody seems to really enjoy and like seeing is particularly that substitute piece there. Apparently there was a very complicated formula as to how many hours you could use substitutes. That has been simplified to, as you see there, 60 hours times the number of classrooms. That's how many hours of substitute hours per year you can have in the center. Just the feedback from folks has been that is a welcome and much more simplified process for you guys to calculate how often and how many hours you can use substitutes. Next slide. In training, this is brand new in the standards. It's called Child Care Licensing Basics. The idea here is that anyone hired after that July 1st, 2027 date, you'll have to take one class that covers, just like the name says, kind of the basics of childcare in Minnesota. So topics like licensing, fundamental supervision, you can read it there. It's kind of a primer, one class that we can do. We can cover a little bit of everything to get you ready to be in a child care center. We are working on creating that, and we will be in touch as when that becomes live and when you need to start having new employees take that class. That class will count for in-service training hours. And then in other changes, you see we added research cameras and social media participation procedures to orientation, and that orientation may now count towards in-service hours. Next slide, please. All right, so you'll see in-service training hours have moved from 24 to 20 per year and 12 to 10 for part-time staff. Again, you can read along with me. Added in 2 in-service training requirements, supervision and behavior guidance, and it's like the last slide, orientation and child care licensing basics will count towards your in-service training. Next slide. All right, this one is hot button recently, given our air quality and our temperatures. And I will share a story. My daughter is a center teacher in Winona, and she was at lunch last week with a bunch of other teachers, and they said, you know, we saw the new rules say that you can't go outside if it's over 100 or below 15 degrees. And if you take away the ability to send my littles outside when it's below 15, that's not going to work. That you can see in the very bottom. What we did is we set some guidelines for you that if it's over 100, accounting for heat index, under 15 with wind chill, what you have to do is have a plan for how you're going to deal with those extreme weather situations. For example, I was a soccer coach for a long time, youth soccer coach. When it was really hot or really cold, we would shorten up the outside time. We would add drink hydration breaks. We would make sure we had shade, or we'd have some inside time to let the kids cool down. In the winter, requirements that hats, mittens, snow pants, that kind of thing. All you have to do is put that in your plan so that you have a plan for those extreme weather events. And as you can see here, that's based on guidance from national, state, and local authorities. But also keep an eye on, I'm sure everybody's seen the extreme air quality alerts, heat alerts. Those track pretty well with the 100 and the 15 degree points that we chose there. But again, I want to make sure that people know this, because I've heard back. It doesn't mean that you can't go out if it's over 100 or 15. You just need to have a plan in place so that you know in those extreme situations how you're going to take care of those kiddos. Next slide. Okay, and Brandon, you may be hopping in on this with me. Furnishings and equipment. We've tried to simplify this as much as we can. Basically, we have 9 interest areas, and you can see some of them there: creative arts and crafts, math and science. I think there's dramatic play, there's fine motor skills. But there are 9 interest areas that we're going to be categorizing equipment. And what we're asking centers to provide are 3 choices of indoor activities and a choice of outdoor activities, so that when all children are engaged, a child has 3 choices if they're inside and 1 choice outside. So for example, if you have a reading spot and there's 5 places to have kids read, that's 1 choice for those 5 kids if there's another spot. painting area would be another choice. Kids kicking a soccer ball is another choice. You just have to have enough equipment and choices for a child to have 3 choices. That didn't come out nearly as clear as I would have liked. Brandon, do you have anything to add there?
I think well, and I got one question of does a buggy ride count as an outdoor activity? Yes, that would make sense to me. I mean, you're outdoors, you're doing an activity.
Yeah.
But I think the bigger picture thing is, and I should clarify too. I didn't mention this, that part of the thing that we're going to be getting ready over these next 12 months is interpretive guidance. So it'll be a document that lives outside of the licensing standards because they'll all be in statute now. But the interpretive guidance can explain some of these things in more detail, and we are definitely going to have some for this because we've gotten a few questions already about exactly how to meet this standard. But I will say that the intent here was there was is more flexibility in how programs are able to offer a variety of activities to kids. So you have your if a child has those 3 choices of activities, or if you're outdoors, they have at least one choice. It's shifting it from less of a focus on do you have this specific equipment per child to looking at your license capacity and looking at the amount of activities that are available to those kids, and do are kids having those choices? We'll have more specific guidance on that and dealing with different scenarios in the interpretive guidance. But for right now, that's what I'll say about this one.
And it's important to know. I think it was mentioned earlier on. This process has been multi-year and has been through many different variations. We're still figuring some of this out based on changes the legislators made at the end of session. So when I asked Brandon, can you hop in with how you understand this? This is something we're still working on. So when we get it nailed down and get it clear, that'll be coming to you in our newsletters, in more trainings. Again, the goal is July 1st, 2027. All of us on this message or on this call and that are doing childcare will have clear understanding of what the new rules are. So we apologize that we're still sorting through some of this. So if you have questions we can't answer, please keep sending the questions. We need to figure out where those fuzzy and confusing parts are. And we were just talking about it today. This is one that we're going to try to make sure that we have clear examples for you to follow, so that you know what the new rules are. Next slide. Brandon, I was leaning on you on this one, so.
Okay. Yes. Natural. So this is this language. There is new language. It's right after the equipment section. So if you go to the the language, there's like 142H.14, which is the equipment section, and then there's a section right after 142H.114.1 that says natural elements and materials. So it comes from it's about natural materials and natural play. We call this language permissive language. So most of the licensing standards are about what you must do as a license holder. This language is saying, also, just letting you know, these things are permitted. So what you may do. So the allowed materials that are clarified under this section is that, so if you have natural loose parts, sticks, leaves, pine cones, things like that, that's okay, that's allowed. If you have sensory materials, dirt, mud, sand, water, ice, those things are allowed. Of course, within the confines of all of the other things you must comply with. So, for instance, this is called out in that section that natural elements that are choking hazards must not be accessible to children under 3 without direct supervision. So, this is a section that's trying to give more clarity because license holders were not sure if playing with natural materials was okay. So trying to give that clarity, but also making sure that it's done in a safe way. So that's really what that section is.
Thank you, Brandon. And I think the one more thing to mention there is a lot as we were going through this, programs we're asking, like especially in like cleaning equipment and cleaning things. If we're outside, kids are going to get in dirt. Yes, you're not going to clean pine cones or sticks. Those are acceptable. Again, just trying to make things clear. Next slide. Okay, special healthcare needs and sick children. You can read along here. I think again the parts that we've had questions and asked to highlight is mostly on that exclusion of sick children piece. So we've given providers some clarity on when they can send kids home. So we have standards that are tied to the Minnesota Department of Health. It's their infectious disease manual, and provide a framework for when you should notify parents, and then have a explicit return to center criteria, and that's all based on, again, the MDH guidance. And then on the other side, you can see the new rules will say all activities must be designed to include all children unless there's a medical contraindication. And then you can see for the allergies and the ICCPP stuff there. We'll go to the next slide. On health, so health consultants. So you do not need to have monthly health consultant visits after July 1st, 2027. You may continue if you have a really great relationship with your health consultant and that's something you want to do. You can still have monthly or more, but under the new rules, you only have to have quarterly visits now. On the second bullet point, you see we're asking for you get permission to apply sunblocks, bug sprays, things like that. Once you get parental permission, you don't need to have that permission for every time you put on sunscreen, every time you put on lip balm, put on bug spray. Again, hoping to take some of the burden off of you on things that just make sense. Like a parent said, you can put on sunscreen. That means you can put on sunscreen when they need it, not have to notify me every time you do it. And then on the last one there, we removed the yearly documentation of reexamination for every child just to go to childcare. So that's, again, one less thing that you're going to need to do paperwork on, and one less thing that parents and you are going to have to figure out. Next slide. Attendance records. I feel like this is important to note. There has been some CCAP attendance record some rules starting. These are different, and it can be confusing. Feel free to ask questions. We have folks looking at those. But starting July 1st, 2027, all centers must take attendance for all children attending, regardless of if they're receiving any kind of funding from somewhere else. And then on the second bullet point there, I call this the Kevin McAllister rule. For those of you who have watched Home Alone, you know how easy it is if 12 kids are in the van and you count heads, you got 12 kids, but we're not always sure if one of those kids is somebody who hopped on and was joining your club for the ride or the kids you needed. So we will have classroom level tracking. The idea there is, heaven forbid, something happens and we need to know where kids are in each room, firefighters or police or parents come, you know where Kevin McAllister is. If he's on the playground, if he's in his 2-year-old room, or where he is in the building. Next slide. These are all pretty self-explanatory. We moved fire inspections now to every 5 years. And I know I've been saying July 1st, 2027 a lot. This is the one thing that doesn't take effect on 2027. It'll start to take effect in 2029. And I want you all to know that you may not need that first inspection right away in 2029. Our friends that do these inspections asked for a way to break these up so that not every center in the state of Minnesota needs to have an inspection on July 1st, 2029. So based on when you first got your license, and that's something we'll notify you on. I think it's 4 or 5 years, but we're breaking out those when you will need those over a period of time, just to allow the inspectors the ability to do the job. Again, they just couldn't get to every center in the state in 1 year, so we broke that out over time. And then you can see previously there was no upper temperature limit for in the building. We now have that set at 68 to 82. And there are some new outdoor play area safety standards on fall zones and removing sharp items and hazards from natural play areas. Next slide. Let's see more about the facilities. We added parameters to hazardous objects to help provide some clarity for licensors and you guys as to what is considered hazardous objects. We updated the animal vaccination requirements. So if you have an animal that actually needs requirements, as opposed to some, there was a story about some turtles that kept coming up. Don't know if there's turtle vaccinations, but if you have dogs, cats, those kind of things, in the children's presence, you need to let the parents know and have required vaccinations. And then we defined some rules for if pests are found in your center, notifications and how to take care of that. And then I think we're almost done here. Next slide. Yep, environmental health. So for radon testing, there is no requirement to test for radon. However, whether you test or not, you need to notify parents whether you tested or you didn't test, and if you tested, what the score was. And if you have to do remediation, you have to share that. And then next slide. All right, this is the last one. So what we're working on right now, and Brandon alluded to this a little earlier, we are sending a monthly newsletter. And I would say probably more than half of that newsletter is based on questions we get from the folks that I'm talking to right now that are out there. We get questions into our mailbox or we get questions in our chat. And we will answer as many of those questions as we can in our newsletters. We'll also be highlighting specific changes that are coming. Each month we'll do a new item. I think last month for centers, we highlighted some of the directors' changes and qualifications and requirements. But the idea is to kind of chunk out all these changes for you and give you each month just a new piece of what is coming. So you can take all of this information in slowly, and we can help answer some questions. But in addition to the newsletter, we're working on the implementation plans, training materials for licensors and for all of you providers. As Brandon mentioned, a interpretive guidance manual. So rather than just reading dry legalese statute, we're going to try to kind of have a plain English with examples of this is what that means in real life. And then I think Brandon also mentioned for abbreviated inspections and weighted risk. The goal is to roll out the weighted risk system on July 1st, 2027, along with the new standards. For abbreviated inspections, we need to have at least a year of the licensures going out and you guys working with the new laws, so that we can determine the indicators. I think Brandon mentioned the key indicators earlier, but we need a year of good data before we can start with the abbreviated inspections. So that won't kick off until July 1st, 28 at the earliest. Let me see if there's anything else on there. I think that covers just about everything. I've heard a lot of binging, so it sounds like there's questions coming in, which is great. So I'm going to stop and give it to Emma. And I believe that's how we'll start working through the questions.
And go for it, Emma. Or were you just going to hand it to me?
Yeah, well, I'm going to read out. We've had some questions come into the chat. We've been able to get to most of them already. We have a couple that are important to read out to the group that are kind of more widespread topics that we want to share out and make sure everyone is hearing that same thing. So the first one of that style that we had was a question that came in. Even though many of these changes won't go into effect until 2027, can some be used now, such as staff requirements? And then, yes, Brandon, over to you.
Yeah, thanks, Pat, for the question. The short answer is no. These are not effective. So, that's the way the laws work. When the legislature passed these standards, they said these new standards are effective July 1st, 2027. So until that date that the legislature set, it's business as usual, continue with following Rule 3 and the applicable parts of Statutes 142B. So you can't, just pick and choose from the standards that passed before they are effective. So just got to wait for that July 1st, 2027 effective date. There are, you can submit variances for staff qualifications just as you already can. So, you can do that. But yes, the answer is no, you cannot you cannot choose to make these changes for the new standards effective before the effective date of July 1st, 2027.
Great. And then we've had some questions about college courses and credits, if you want to talk a little bit about that.
Yeah, so thanks for the questions. Essentially, when we were talking about credits with the teacher and assistant teacher qualifications, we're talking about post-secondary semester credits. So you can get the and also under the new standards, any post-secondary semester credits count towards that. So if you have someone who you're qualifying, as long as they have those credits from an accredited post-secondary institution, you can just count up those credits, and those credits count towards qualifying that person under the new standards as of July 1st, 2027.
And then we've had some questions about accessing the presentation and the slides, and we are recording this presentation and we will need to get it transcribed and captioned and then up on our website. So that will happen. It generally takes us a couple weeks to a month to get through that process and get it up online, but then it will be there for you to review the entirety of this presentation that way via recording on our website.
And I think there were questions too we got about the how the choices work for the new equipment, or the new choices of activities requirement. And again, I'll just say we're planning to have more information about that in our upcoming August newsletter for the childcare licensing standards. As Kent mentioned, we are planning to send out monthly newsletters kind of spotlighting things and giving clarification, so we can have more information on that. And then also more sort of evergreen guidance on that in the interpretive guidance that will be developed later. But all of your questions are really helping us as we draft those things. So thank you.
That is what we have for you all today. You get about an hour back in your day. We will stick around online here for about another 5 minutes or so, just to make sure that we have gotten answers to all of the questions in the chat. I know there's one we're working on an answer for right now. And then that is all we have for you. So thanks again so much for being with us today, and we hope you have a great rest of your week.
So I think there was a question from, I'm trying to find it here. Getting a lot of pop-ups. There was a question on, do all directors have to meet the new standards? And what would the staff person who is serving as the director when the director is off-site need to meet? This is a very good question. The designees do not need to meet the director's standards. However, they need to be at least 18 years old, and they need to understand and be able to perform the duties of director. So I think basically what we said last time was if your licensor comes in and the director isn't on site, and that licensor says, all right, well, who's the designee? They need to know who the designee is. That designee needs to know they've been chosen, and they need to be on site. And as long as they're over 18, that'll be fine. Let's see, was there anything else to that question? Do directors all have to meet the new standards? Yes. As of, well, like I said, if you're currently a director, you will be grandfathered in until you move. So anybody who starts or wants to be a director after July 1st, 2027, they will need to meet the new standards.
Oh, we also got a good question from Sarah about what year do we need to notify families about the radon testing, 2027 or 2029. So July 1st, 2027 is the effective date, and you need to notify parents whether radon testing has been done or not, and if it has been done, what the test results are. So you do need to meet that by July 1st, 2027. We're working with MDH right now to have a form that's already ready for you to use, so you can just easily use that and it'll meet the requirements. One exception I do want to clarify to we're saying everything is effective July 1st, 2027. And I think, Kent clarified this, but just want to reiterate, fire inspections, those are not until 2029. So those have a slightly, there's more of a delayed implementation, and then you have the sort of staggered implementation. So there'll be more information on that, but I just want to clarify that as the one exception to the 2027 effective date. But yes, radon still 2027. Okay. There's also one question about, is the CDA no longer good enough to qualify someone as a director starting in July 2027, from Sammy. So the requirement will be 12 semester credits or 120 hours of training in those topics like supervision, child development, and then a certain amount of experience. I think it's 1,040 hours of experience. So again, I know it's a little clunky right now, but when you have specific questions like that, I'd say the best thing to do would just like reference the language. But a CDA isn't specifically called out. So just want to clarify that.
And there was another question about radon. Are there resources or grants available to offset costs? Again, you don't need to do radon testing. If you don't do testing, all you have to do is notify the parents. If you do, however, do the radon testing, you need to post what the results were. I don't believe, Brandon, before I say anything wrong, I don't believe there are any grants or resources available for radon testing, but if I'm wrong, I'm sure somebody on this team will tell me I'm wrong.
No, not for yeah. We can look into that more and ask, but as far as I'm aware, for licensed childcare centers, no, there are not grants. But that said, we are in active communication with MDH and their indoor air unit there. And so if there are things that people feel are confusing, you can certainly send those questions to us, and we can work on getting more resources, more information from MDH to answer any sort of questions that are coming up for you.
But again,
but in terms of financial resources, no, not aware of those.
But again, there is no requirement in the current or new rules that mandate you have to do the radon testing. That's a choice you can make center by center. Is there any other questions from, I guess I'm asking our team, any other questions that we haven't covered yet?
So I'm seeing some questions still come in. So Kate has some questions about what changes did the legislature make in the final hours of the session? What was the rationale behind decreasing registered nurses visits? I think we want to stick to questions about like, what's in the new standards. Doing a I'm not. So yeah, I don't think we can speak to those questions as much of all of the process things about the last minute changes. Appreciate the wanting to know and the curiosity, but yeah, if you have questions about what's in the standards, happy to answer those.
And again, as Brandon mentioned, this was part of about an 800-page omnibus bill. That was one of many at the end of the session. So in this bill, they had everything from the funding for Hennepin County Medical Center to a bunch of other programs. So yeah, explaining to you how all those amendments came through. It's just not something we can do right now, but it's all available on the Minnesota Legislators website. If you go to the website and search Senate Bill or Senate File 4612, you can take a look at all the changes that were made over the course of that debate.
All right, thanks everyone. I think we have gotten to most, if not all, of our questions. Remember that you can visit this handout link that's down here on the slide still. Bottom, you'll see it down there on the bottom left. And there are ways to reach out to our team, reach out to the policy website, things like that. There are plenty of ways to contact us listed there. If you think of more questions you have, just reach out. We want to hear from you. Like Brandon and Kent said, they are putting together that newsletter. And we want to continue to address these questions via that newsletter as we continue to dive into modernization. So thanks again for your time today, and hope you have a good rest of your week.
Thanks, everyone.